Having healthy teeth and a healthy mouth is the key to a person's overall health and well-being. Unfortunately, oral diseases are more common than you may think and cause significant pain and disabilities for many Americans. Having healthy oral hygiene improves one's ability to speak, smile, smell, taste, touch, chew, swallow, and make facial expressions to show feelings and emotions. After this presentation, each nursing student should be able to properly inform patients on the risks and benefits of oral hygiene, as well as being able to explain and demonstrate proper oral hygiene.
Oral health is a part of everyone's day. If someone doesn't understand how to properly care for their mouth and teeth, they could be at risk of cavities, tooth decay, oral and facial pain, oral and pharyngeal cancer, or even dry mouth. Certain populations of people are at a higher risk of oral infection, including those who have a cleft lip or palate, those who smoke or chew tobacco, young children, and even the elderly. According to the World Health Organization, oral diseases are the most common non-communicable diseases and affect people throughout their lifetime, causing pain, discomfort, disfigurement, and even death.
According to the National Institute of Dental and Craniofacial Research, approximately 5% of adults aged 20 to 64 have no teeth. According to the Oral Cancer Foundation, there will be about 54,000 individuals diagnosed with oral and oropharyngeal cancers and 13,500 deaths per year in the U.S. alone.
I need my toothbrush.
Hey guys! Did you know that during physical activities you should always wear a mouth guard?
According to Healthy People 2020, the goal of oral health is to prevent and control oral craniofacial diseases, conditions, and injuries, and to improve access to preventative services and dental care.
So now, since we talked about your past medical health, we're going to go into what brought you in today. So could you elaborate a little bit more on your mouth pain?
Yeah, so like my jaw and like my gums, these have been really hurting.
Okay, do you notice if anything makes it worse or anything makes it better?
It kind of hurts like with like hot or cold things or like when I'm eating.
Okay, do you notice it makes it worse with smoking tobacco or chewing tobacco or drinking alcohol?
No, not really.
Okay, do you brush daily?
No, I use a comb.
Okay, on your hair?
Yeah.
Awesome. Do you brush your teeth daily?
No, I don't have hair on my teeth.
Okay, could I look inside your mouth?
Mm-hmm.
Awesome. Could you open up? Okay. I'm gonna go grab a toothbrush and then I can explain to you what that is, okay? So here's a toothbrush, and what we're gonna do is we're just gonna put some toothpaste on the bristles of that, and you can put it in your mouth and just go around in your mouth and make sure all your teeth are nice and clean. And I can show you later on in the appointment how to properly use the toothbrush, but just so you have an idea, okay?
Great.
So also along with making sure you brush your teeth, it's also important to have a healthy lifestyle with eating habits. So making sure that you eat a lot of fruits and vegetables instead of a lot of like sugary cereals and desserts and stuff like that. I know it's hard, but it's important to have a well-balanced diet.
Okay.
In addition, also like chewing tobacco and smoking a lot can cause a lot of risks into your mouth. So like it could cause cancer inside your mouth, which we don't want, or cavities, or like tooth decay. So by cutting down on those, then we can definitely help to reduce your oral pain, your mouth pain, okay?
Okay.
So here's a pamphlet on ways to help reducing your tobacco use, just so it can help with your oral care, okay?
Great.
Also some just going past your mouth specifically, but making sure your jaw, everything stays safe. If you're in any physical activities or doing any physical sports, wearing a mouth guard can also be pretty helpful.
Okay, what about like my underwater basket weaving?
Is there physical activity in that?
No, not really.
Okay, then you wouldn't have to wear a mouth guard. Only anything that involves physical contact.
Okay, great.
Let me get my other brochures. Now we're going to go over the most effective ways to brush your teeth. And here's a pamphlet on good products that we would recommend to use when you go to the store to buy things. So first, you're just going to wet your toothbrush, and you're going to put enough toothpaste on there, then put it in your mouth, and you're going to go along every tooth in a circular motion. You're going to try and do that for 2 minutes, and making sure you also get your mouth and the sides of your cheeks as well. And then once you're done with that, you're just going to spit that out and thoroughly rinse your mouth. And then we'll go in with some floss, which is like a string type of thing. I can show you when we go into the bathroom.
I can just show you. Floss.
That's a good dance. I really like that dance. This is like not as exciting as that. It's just like a string that you put between your teeth.
Oh.
But you could do the floss while you're flossing. That could be pretty cool. Yeah. So we're gonna go into the bathroom and I'm gonna show you how to brush your teeth properly, okay?
Okay.
Okay, so we're gonna start off by turning the water on. And then you're gonna just get the bristles of your toothbrush wet. And then with the toothpaste, you're just gonna put like a good amount on there, just kind of so it covers the majority of the bristles. Yeah, just like that. And then you're gonna put that in your mouth and brush around and make sure you get every surface of your tooth. So the sides, the top, and the bottom, and the insides. And then you can make sure you brush your tongue and your cheeks.
It's kind of hard.
Yeah, you really want to make sure you get down at the bottom because that's could be where the tobacco goes, and just to prevent infection, to brush it down there.
Yeah, it kind of hurts.
Yeah, the more you brush, the better it will feel.
Okay.
Alright, it's been about 2 minutes, so you can spit out. And then use this cup of water to just thoroughly rinse your mouth. Yeah. And then here's a towel to dry off. Does it feel better?
Yeah, it feels clean.
Good. So now we're gonna go with the floss, and then you're just gonna get about a foot long. Yeah, and then you're just gonna twist it around your fingers. Yep, just like that, and do it on the other side as well. And then just go between each tooth. And it might hurt a little bit or might bleed a tiny bit, but over a period of time your gums will get stronger and it won't hurt as bad.
Okay.
But you have to keep doing it just so it works. Alright, so it looks like you've gone over all your teeth. So now, how does that feel?
Feels clean.
Good, good. Now we can go back into the office and go over what we talked about today. Feel free, you can take those 3 things, and then once they run out, you can just use that pamphlet and have some good ones to buy next time, okay?
Alright.
So now, after we walked through how to brush your teeth, could you summarize what I talked about today?
Yeah, so you want me to eat less desserts, sugary snacks, and cereal. You want me to chew tobacco and smoke less.
Yeah.
And you want me to wear my mouth guard when I'm doing physical activity.
Yeah, and don't forget about brushing and flossing your teeth twice a day.
Twice a day.
Yeah. Could you walk through how to brush your teeth? Just like the step-by-step way?
So you said step 1, get the toothbrush wet,
Mm-hmm.
put on enough toothpaste,
Mm-hmm.
and then I want to brush in a circular motion to get all my teeth, cheeks, roof of my mouth, and tongue.
Yes.
Okay, great.
And then what do? You spit out.
Oh yeah, I spit it
yeah.
out.
Then you rinse it out.
I rinse.
And then what
make
would
sure
you do
not
next?
to swallow it, and
Yeah.
then dry off, and I'm ready to go. Then
Yeah.
I'll look good, and I'll feel good.
Yeah. Don't forget about flossing as well. Okay.
Oh yeah, I gotta floss my teeth.
Very important. All right. Thank you so much for coming in today. For a follow-up, I'd recommend going to a dentist and just getting a thorough checkout of all of your teeth. But I hope today was informative for you and you feel like you're able to help with your mouth pain.
Thanks, Nurse Riley.
Yeah.
As you have seen, Riley was able to educate Lane not only on how to perform oral hygiene on himself, but she was also able to inform him on the importance of oral hygiene. She pointed out the key factors that play a role in Lane's oral health, such as tobacco use and eating a well-balanced diet. At the end of the appointment, Lane was able to summarize what Riley taught him and demonstrate proper oral health. We can conclude that this was a successful teaching demonstration because of Lane's ability to display his understanding of the information. Now, this clinical role was a bit of an exaggeration, so it's good to know that your real-life clinical education session will most likely be easier than this. Remember, when you're educating a patient on oral hygiene, it's important to know what each individual patient's typical daily routine looks like, what their lifestyle habits are, and what level of interest they have in oral health. This way you can adapt your education to fit each individual's needs. The most important information we talked about today is the risks of improper oral hygiene, how oral hygiene can help a patient's overall health, and where a patient can find the proper resources and supplies to perform oral hygiene. Thank you so much for watching, and we hope you learned more about the importance of properly educating patients on oral hygiene. Thank you.